Very warm greeting to all the participants and the audience here for this international e-conference. Good morning to all. I am more than grateful to be here and welcome you all this international e-conference on research methodology in nursing. Today, I, the Professor Ashok Mangoli, shall be walking you through the conference. Before I invite the orators, I would like to introduce you to the today's chief guest, according to Sri Abhi. Great leaders have three things: inner insight, inner vision, and inner strength. He is none other than our beloved President of Dr. Suhash University, Rajbhai Chavda sir. Welcome you, sir, and I thank you, our dear sir, by giving us an opportunity to organize international conference on research methodology in nursing. For the benefits of our dear students, faculty, and other participants. Sir, with your continuous efforts and will to do something for society and move up towards a successful and fulfilling world. Thank you very much, sir, and welcome you. Now, I would like to offer positive salutations to today's chief guest, Dr. Deepak Patel, sir, Provost of Dr. Subhash University, and sir is also backbone of School of Nursing. Your presence here at this conference will not only inspire us all to be highly motivated, but also urge us all to do better in life for humankind, just as you did in your field. Welcome you, sir. We all have the opportunity to present on virtually here together. This international e-conference will not only guide us all, but also educate us regarding a variety of pertaining to research methodology in nursing, overview of research process, identify and state the research problem and objectives, formulation of hypothesis, discuss review of related literature, and describe the research approaches and designs, sampling process, and tool for the data collection, etc. We all are surely grateful for this prospect. On behalf of Dr. Subhash University School of Nursing, I would like to welcome you all and inform you that the International E-Conference will completely enlighten you pertaining to the research methodology in nursing. All the important aspects regarding the topic will be conveyed to you all. You shall exit this stream ad space with a zero doubts, as our educators will ensure that they answer all your queries. And once again, I welcome you all on behalf of Dr. Subhash University School of Nursing, Junagadh, Gujarat, India. Welcome you all, dear students, faculties, and today's orators. We are going to start with our plenary session with by Dr. Sindhu Thomas, Madam. Ladies and gentlemen, we rarely get this kind of opportunity to listen to the word. A great knowledgeable speaker is none other than Dr. Sindhu Thomas. Madam has completed her UG and PG in nursing, and also she has completed her PhD, and she specialized in child psychology from Madras University. And Madam is presented national and international oral presentations and poster presentation, and also she is the awardee of first rank holder in her MSc. Madam, I invite Professor Sindhu Thomas take over the proceedings.
Warm greetings from MGM Institute of Health Sciences and MGM Bombay College of Nursing. Ma'am, can you hear me?
Yes, madam.
Yeah, and I really be grateful to all the honored people from your side and ma'am for giving me an opportunity for getting this platform. Thank you so much, ma'am. So without wasting much time, I would like to start with my presentation. So today the first plenary session is on a brief overview on research process. Next slide, please. So the objectives of this session is by the end of the session, each participant recall the meaning of the term research and list down the significance of research in nursing, enlist the types of research, explain the overview of research process, and also throws light on past, present, and future nursing research. Next slide, please. Next slide. Yes, thank you. So, since it is a basic topic, I really would like to go in little detail and it's a basic thing. So, what is research? Usually, people have come up with definition. I just want to make you understand what is the concept of research. Research is different from other methods. Is it is a systematic scientific problem. I mean, scientific process. Mainly, we are finding the solution for the questions what is arising in the society or in medical field or in the nursing field. So basically it is a problem solving method and it answers any question regarding the facts or how the facts are related. So in short, we are researching on the current practices and see what is good for a better systems and it will be changing day by day. So this is the actual meaning of the term research. Coming to the next topic, what are the significance or the importance of research in nursing? Next slide, please. So if we see what is the significance, first and foremost thing of a person in the field of nursing or the medical profession is the patient care. As long as human beings are there in this world, patients will be there, and we are learning, we are doing research, or whichever scope of area of nursing we are looking into. Research is mainly standing for taking care of the patients. So the first and foremost significance of nursing research is improve the quality of the patient care what we are offering at bedside. Second thing is develops an evidence-based practice in giving care. If you see the term evidence-based practice, it is well utilized in all the settings when we talk about research. It is none other than the meaning we are finding or we are taking a decision for a better clinical practice. So, for example, before we used to, in ancient days, we used to keep the thermometer what we are using for patients in the Savlon solution or Dettol solution. Now it is not needed. We are directly taking from the patient side or the hospital side and we are cleaning with a spirit swab or a swab with the sterilium and we are using with the patient. Why this has happened? Because it is not because the Savlon solution, Dettol solution was wrong. If the solution is not replaced, that itself become a media of development of bacteria or other organism. So we change the practice of not putting into anything. We are directly using the thermometer to the patient. So this is a simple example we all can understand for evidence-based practice. Every day we are changing the practices based on the protocols of the hospital as what we are getting evidence from this clinical guidelines or evidence-based practice. The next thing or the next importance is better equipped with latest information in the field. We know that the science is changing every day as technology is improving, as research is going on, the information is keep on adding. So, as nurses, we are able to understand what is the latest information and we are able to work accordingly than practicing the traditional or previous practice. Also, research expands the body of knowledge. So that's why the importance of articles coming, or we are asked or encouraged to be in the conferences, so that what is latest practicing we are able to understand and we can improve our knowledge day by day. Then what the book says, we are able to know what is happening and we are able to up to date our practice. Again, research validates and defines the existing practices. Whatever practices we are doing in the hospital or administration or in education, we are able to improve and we are able to work in a better way with the practices what we have. More than that, the research in nursing helps us to make the healthcare efficient and cost effective. See, by the end of the day, we need to understand that how feasibly or how cost effective we are able to give the care to the patient. If it is more expensive, it will be very difficult from the consumer side as well. So research helps us to understand what is efficient with less price, so that the consumers of the hospital can benefit from whatever new services, new projects or new devices we are giving in the market. Also, research helps to accelerate innovation. As nurses, we are also encouraged to come up with innovative ideas and devices so that it can improve the patient care in our medical field. Also, it helps for problem solving. See, wherever humankind are there, there are problems. So when coming to our field of nursing, wherever the issues is coming up, we are able to tackle by using the research. So this is the significance of research in the field of nursing. Coming to the next slide, that is types of research. If you see the types of research, the research is divided into two aspects. First is based on approach, and the second one is based on the purpose. So let's deal with purpose first, then we'll go to the approach division of research. Based on the purpose, there are mainly two types of research. That is basic research and applied research. If you see what is basic research, what the students are doing mainly for the BSc project or PG project or PhD project, what they're doing is they are trying to describe, explain, and explore what is available. So mainly it's keep on adding the knowledge what is there in the field of nursing. This kind of research is known as basic research. Coming to the applied research is mainly for taking decisions. So what I want to say that in case of industry or in case of hospital, when we are able to understand what method is better than the other method, that kind of research. For example, if you are giving two kind of treatment for diabetics, we are giving suppose for a food care, someone is dressing up with one particular solution or someone is trying with another solution, we can do a comparative study to see which antiseptic solution is helpful for better healing of a diabetic food. So this way in the clinical decision, we are going to do research to come up with a result that will helpful to make a protocol. This kind of research is known as applied research. This is about the types or category of research based on the purpose. Coming to the approach, there are mainly three types of approach: quantitative research, qualitative research, mixed method research. First one is quantitative research. Quantitative research is a research where the variables in the research can be measurable. For example, we are measuring the height with the infantometer in case of pediatrics, or weight with a weighing machine. So whatever we are able to measure and come up with statistical aspect, that is descriptive and inferential statistics, those kind of research comes under the category of quantitative research. Coming to the qualitative research. Qualitative research is mainly dealing with in-depth understanding, as well as we are able to explore or explain the feelings, whereas narrative form is more used in qualitative research. Whereas mixed method research is a research where we are mixing up quantitative as well as qualitative for coming up whatever limitations we can see in a quantitative and qualitative research. Coming to the next slide. The quantitative research is mainly divided into three main categories. First one is true experimental, second one is quasi-experimental, and the third one is non-experimental research. True experimental research, in the sense, it is also known as randomized controlled trial. As the word says, randomized controlled trial, there should be three categories to call it as a randomized controlled trial or a true experimental research. The three criteria are there should be randomization, there should be a control group, and there should be a trial. Trial means the experiment what you are going to do. For an example, if I'm trying to work on a breast clot, effect of breast clot on immediate initiation of breastfeeding. So what I'm trying to do is, if I want to use a true experimental method or a randomized control method, there should be a randomization. First thing, randomization means I'm giving equal chance for all participants to be a part of my research study. So this is randomization. Okay, so in small example, what I can say is we are trying to take lottery method, or if you want to select two students from your class out of the 50 students, you can put the roll numbers and you can pick up two from there. That means all the 50 students are getting equal chance to be a part of that particular study. This is known as randomization. Next one is control. Control means in an experimental study, there should be two groups, whereas the first group is a control group and the second group is an experimental group. Experimental group is a group where you are going to actually giving an experiment or the intervention, so or the trial, so that that group and another group we call it as control group. So you can compare what is the difference in the result of the experimental group and the control group. So this way we are able to understand. So that is the control group. And one thing I would like to identify from this point of view is we cannot withhold any kind of intervention in control group because this is ethically against. So what you can do is whatever traditional what we are giving, you can continue, or placebo can be given. In case of treatment, you are ethically wrong if you are not giving any treatment to the control group. Call, but not the intervention. So this way you are able to understand how these things differ from each other. The third thing is non-experimental group or non-experimental research. Sorry, I forgot to tell one thing. Yeah, I covered all the things. Randomization, control, and trial. Trial is I'm putting an intervention or experiment. The third method under quantitative is non-experiment. Sorry, the second one is quasi-experimental research. In quasi-experimental research, there will be one intervention, either randomization or the control group will not be there. If that's the case, I will call it as a quasi-experimental group. If randomization is not there, control group is there, you can specify the subcategory of the quasi-experimental research what you're going to use. Coming to the non-experimental research design or not design research, there is no experiment. You are just explaining what it is. Suppose I want to see the prevalence of COVID among the school going children, or I would like to see the hospital acquired infection, the prevalence of hospital acquired infections among the patients admitted in a selected hospital. So this way, without an intervention, if I'm doing anything, that will come under the category of non-experimental research. This is all about quantitative. Coming to the qualitative research. The qualitative research, there are four subtypes are there. The first one is the phenomenology. Phenomenology is a type of qualitative research, whereas we already told that there won't be much statistical technique in qualitative. Here we are learning the phenomena, what is happening in the life. So for example, a study to assess the life experience of COVID affected families where the spouse has died and how they are managing a sudden death has happened. So whatever phenomenon we are going to explain. So if you are doing a study like that, that will come under the category of phenomenology. The second one is ethnography. Ethnography is mainly with the ethics or ethnic group or the cultural study, whereas we are able to understand what kind of research can be done with the culture of that particular group. Suppose if you're going to do a tribal group and see how their education status is or how their lifestyles are. So this way, cultural group we are going to check a study. We bring it under ethnography. The third one is the grounded theory. Grounded theory research mainly deals with the social aspects of that particular group. See, the social aspect, the education of the women or the women empowerment. So this kind of social issues we are going to do the study. That kind of studies we call it as grounded theory research. The next is a case study. Case study is mainly with we are taking an individual or a family or a group, and in that we are going and learning and working on that particular case. So this is known as case study. And the last one in qualitative studies, the historical research, whereas the history of the patient or the samples is collected from the records, whereas we can call it as a retrospective study, can mainly seen with the in-depth study. That's why it is coming under qualitative study. So that category is the historical research. Coming to the mixed method type. So again, four types of mixed method of research is there. Convergent research, explanatory sequential research, exploratory sequential research, and embedded research. The first one is the convergent research. The convergent research is also known as concurrent triangulation design. That means the researcher collect both quantitative data and the qualitative data at the same time, and equal weightage is given, and the data will be used equally for data interpretation. So this is the convergent research. Okay. The second one is the explanatory sequential research. So what is happening in explanatory sequential research? There are mainly two phases happening. So the first phase, the quantitative research will be happening, and then the data analysis has been done, and what all further explanation is there, that is happened as the second phase, that is the qualitative research will be taken care. So both the data what they are getting will be taken care, and data analysis will be done in explanatory sequential research. The third type of mixed method of research is exploratory sequential research. In this exploratory sequential research also, there are two phases. So what happened in the first phase, we'll take the qualitative data, and once the qualitative data is taken and data analysis done, and we are making a tool, or we are taking a model where a theoretical model will be made, and in the second phase we are applying this tool or the theoretical model so that the further data collection can be taken up. So this type is known as exploratory sequential research. The final one is embedded research. Embedded research is a research method whereas the researcher uses both quantitative and qualitative research simultaneous. That is a traditional method they use. Wherever the limitations of the quantitative research is happening, the investigator uses the qualitative findings as well, so that he or she is able to explain the phenomenon better way by using an embedded research. This is all about the types of research. Next slide, please. Next, we are going to see what is quantitative research process. Why I take up this particular topic is because the quantitative research process is the basic or the fundamental research, whereas rest all the types will be added or deleted from this. So if a person is able to know or thorough with the basic concept, we are able to do better in the remaining classes what is going to happen. So the first step of a quantitative research process, we are going to explain how to conduct a research. Okay, so the first thing we need to understand that before coming up with the steps, we need to identify what is an area. Suppose once you are identifying the area, we call it as thrust area. That is, we are not simply doing a research. Research is going to find out a solution for the need. So where is the need? We are finding up the thing. From there, the research question will be coming. So I came up with a topic of breast growth. Actually, breast growth is I really don't know who all know about breast growth. Breast growth is a practice whereas the newborn baby is kept on mother's tummy itself. That once the baby come out in the delivery room and the baby crawls towards the breast. So what happened? Immediate initiation of breastfeeding will be happen. So in normal practice, the thing is the baby will be taken first. If the baby is not taken to NICU, and later mother will be sent. The mother will be withheld in the labor room till the mother passes urine and there is no immediate postnatal complication. Then the mother will be shifted to postnatal ward, whereas the mother will be very tired after a labor process. The mother will be very tired. So the relatives will be mainly concentrating on the mother, that the tea will be given or the food will be given to mother so that the mother will be recovered soon. Till that our baby will be sleeping. So what happened? Once the mother settled, then only they go for a breastfeeding. So what happened? This always delays the breastfeeding. So what happened? The immediate initiation of breastfeeding can be initiated in the labor room if the hospital have a protocol to have a breast growth in our institution. So what happened if I take this case? So the first thing I find out the area, that is still, even though whatever practices are going on, nearly 40% only having an immediate initiation of breastfeeding according to NFHS data, current data as well. So what we need to do is, if we are finding out that the immediate initiation of breastfeeding is questioned by various factors, whether we can use breast roll. So research question here is breast roll helps or encourages immediate initiation of breastfeeding? From there, we are coming up with a problem statement. So problem statement is a brief statement which put across what the researcher want to do research in simple terms. So in a problem statement, the independent variable, dependent variable, or the research variable should be evident, and mainly the setting and the samples also should be evident. This is the importance of research problem. So coming to the research problem, formulation of research problem, with the example I got it, I can put that effect of breast growth on breastfeeding or immediate initiation of breastfeeding among newborns in selected hospitals or hospital. So this way I can formulate a research problem, whereas I want to tell you that my independent variable is breast growth and my dependent variable is initiation of breastfeeding, and my samples are newborn and my setting is selected hospitals. So this is all about the formulation of research problem. Once my research problem is made, next I need to be careful with how to frame my study objective or research objectives. If you see the research objectives, there can be primary objectives as well as secondary objectives. So either somewhere the primary objectives is known as the aim of the study. So with the example quoted, I can say that this study is aimed to see whether breastfeeding is helping for initiation of breastfeeding, immediate initiation of breastfeeding. And I can have other objectives as well, how the correlation can be happen. Hello. Continuing with the presentation, uh, the next one is the review of literature. Review of literature is a session where one of the speakers is going to deal with it. So the review of literature is whatever available review is there. We are going to present, or we are going to see what all things are available. And by seeing the available literature, it will be good if you take the literature on the past 10 years so that you will get more recent data. From there, you can pick up what is the lacunae, or where is the gap between the theory and the practice, and you can pick up those lines for preparing or making your statement and objectives better. Next step of research process is develop conceptual framework. So conceptual framework is a structured framework, whereas you can put your research into this framework so that you are able to explain it better. Either you can develop a conceptual framework, or you can use a conceptual framework what is already developed. So in a framework, you're explaining from the start to end, this is the plan of completing the research, and these are the expected outcomes, and I'm going to check on this particular outcomes. The next step of research process is formulate hypotheses or assumptions. Hypotheses are actual predictions of the relationship between the variables in the study. And we talk about hypothesis. Hypothesis is there only when there is an independent and a dependent variable. If it is not there, or if it is a research variables are there, that means it is a the non-experimental research will go for assumptions. Assumptions means we assume that this thing can happen. These are the statements are there without any scientific proof. For example, sun rises in the east. Actually, because of the rotation, the day and night keep on changing. But we assume and we all know that sun rises in the east and sun sets in the west. There is no scientific proof for that. This is an example of assumption. Next is select the research approach and design. So there are mainly two types of research approach: quantitative and qualitative, and mixed. These are the three types of approaches we have, and the designs are also differing based on your study. The way we are explained as experimental, non-experimental design, that is again is another topic of discussion in upcoming schedule. Can I see the next slide, please? So once you are ready with your design, we can specify the population. Population is the group of people where the researcher would like to generalize the findings. This is a population. So population is also two types: target population and accessible population. Again, it is a topic of the next talk in this day or the next day. So when you talk about the population, regarding the example what I got, that the effect of breast growth on immediate initiation of breastfeeding among newborns. So newborn is my population in the study what I got it before. Once my population is ready, then I develop the tools for data collection. What tool is ready, or what tool will help me for a data collection? If I'm going to check the practice of the mother, a checklist will be better. But if I'm going to check the knowledge of the mother, a questionnaire will be better. Suppose if I'm going to check the attitude or anything, I can go for the rating scale or an attitude scale. So this is also another talk where the speaker will explain it better and deeper. The next step is establish ethical consideration. When I told about the placebo or the control of a research, I said there is a separate group, control group. We are not expected them to go without any kind of intervention. So why? Because the ethical principles come in account. But according to the principles of ethics, do not harm, because our research should not harm anyone. Rather, it should help. We cannot withhold the treatment from the people, those who are there in the control group as well. So ethical aspect is very important when we talk about research. Along with that, we are supposed to have an informed consent. There is participation sheet with all the information of your research and the consent of the samples, that they are willingly able to participate, knowing the pros and cons of this particular study. and they are free to withdraw from the study at any point of time. And in case of children less than 18 years, we use an assent. Along with the assent, those who are able to understand this, a schooler onwards, you can use an assent for the children plus informed consent from the parents or the caretaker is mandatory to establish the ethical consideration of our research. Once that is done, we can go for a pilot study. Pilot study is known as a small scale study, whereas your sample size is 100, we go for 110, that is 10 samples. We do the same study to see how well study is feasible, how well you can come up with the results. So pilot study helps us the same. Next is the sample selection. So once your pilot study is done, we are going for a sample selection and see for the main study how well I can go for sample selection. Sample selection is mainly based on the probability. So we have mainly two types: probability sampling as well as non-probability sampling, which again explain in the coming days. The next step is the data collection. Once you are ready with the samples and the sampling method, you start your data collection based on the tool and the samples you're going to select. Next slide, please. And the last three steps of quantitative research process is: first one is data for analysis. Once you are done with your data collection, we should enter the data. We call the data, what you're entering is the raw data. So once the raw data is there, we need to code the data. We call this data coding. So we need to prepare the data for analysis. Once the data is coded, then you are able to analyze the data. Then coming to the next step, that is analysis and interpretation of the data, whereas you use and descriptive and inferential statistics to interpret the data. Once the data is interpreted, you are supposed to tell the meaning of the data. Suppose if you're getting a t value, that's I'm talking about, you're comparing the results of two groups using a t-test, which is an inferential statistic. If the value you got as a t-test is something, and what you need to do is, we are using the SPSS or any technology, what you are doing is the p value will check. If the p is less than 0.05, the value you are getting is significant. Therefore, the breastfeed is good to initiate, or breastfeed is better to initiate immediate initiation of breastfeeding compared to the traditional method. This way, you are able to interpret. Interpret play an important role in research process. And the last step is, we usually would compromise with this particular step, that is disseminate the research findings. Once you interpret the findings, we usually make a thesis or a dissertation or a project and keep in library or in our hand. But dissemination is an important step, whereas you are able to tell to the public that this is the findings we got and we can practice it. Because once the dissemination of the result has been done, evidence-based practices can be done in various hospitals. Otherwise, there is no use of conducting this kind of research. Coming to the dissemination of the research result, dissemination can be done either by newspapers or the scientific conferences, poster presentations, paper presentations, or the journals can be published. Whereas the information what we are getting by doing our research can be given to the public, and either further research can be done, or if adequate results are available, the stakeholders can take decision on protocols and have a better evidence-based practice. So this is all about the research process. Coming to the next topic. Next slide, please. Ending up with the nursing research, the past, present, and the future. If we know that the first researcher is Florence Nightingale, and you know that she's the mother of nursing, and no one in nursing will not know who is Florence Nightingale. In 18th century itself, in the 18th century to 19th century, she started working with research. So her main contribution is in the Crimean War, whereas she took care of the soldiers of that particular war. And what she has done is, she started with the mortality and morbidity rate of the soldiers of that particular Crimean War, and she started noting down on her notes of notes on research, and this has happened in the dark ages. So this is mainly we can talk about the past. If you see the past in the 19th century, there are a lot of research has happened, whereas the research has developed internationally. Then in India, the topic has come up. We can refer the books for all the details year wise when what has started, so that we could reach this much has been given in this particular aspect. Next slide, please. If you see in the 20th century, the research is actually advanced than the 19th century. The 20th century, the research, the place of research has really improved. It is mainly because the students or the people has upgraded their degree, and we came to know that various methods of dissemination of our research, so that the results are given to a larger public. The third cause is the availability of the federal funding and support. The kind of support and the funding has really increased, and students and faculty is encouraged to upgrade their research skills. So what happened? So many advantages has happened in the 20th century. Next slide, please. Coming to the future, we are a way ahead to go till in research. If you see that we had put our footprints even in innovation in healthcare, so we are encouraged to start to innovate new what devices or new things, so that the nursing care or the medical care can be improved. Even the nursing has come up with intellectual property rights. They started working with copyright or patenting the devices what they made, so that more credit, because any profession, unless the dissemination of the knowledge and IPR innovation has happened, the development is stagnant. So this particular things has come up, so that the roots and the steps of nursing has really improved. And we need to be more competent in our education, administration, and clinical practice by collaborating with academic settings. More than that, we should apply for further acknowledgement and funding, so that we can have a better development of research. With this, I would like to end up my topic. And today, to summarize, we had seen the overview of research process with the headings of the definition we have seen or the meaning we had seen. Then we had explained the significance of research in nursing. Then we have seen what are the types of research. Then we have seen the overview of quantitative research process with the explanation of each basic terms that what you are using in research. And we have come up with the past, present, and future of nursing research. With this note, I would like to end up my presentation. Thank you, Matt, and all the people concerned to this presentation for giving this platform. Thank you so much.
Thank you very much, madam, for sharing your deep knowledge about overview on concept of research process with us. Your session was full of enthusiasm and valuable knowledge. And I request participants, anybody has got any queries, you can ask madam. Free to ask. Madam is ready to your answers. All your answers will be clear. Dear participants, you can put it on comments box, so that any questions regarding review of literature or regarding research process. Uh, Dear participants, is there any questions or any clarification, any doubts? I think, madam, the children who are participants, They are just started their career in third year. We have started basic research. So that might be a reason they are not able to have much. But still, if they have got any doubts, I think they can contact you. I feel if you give them your number,
Yes, their
and they can.
field
Yes,
I understood it is mainly for 3rd years. That's why I went in that basic way so that
yes,
they are
yes,
able
madam.
to understand.
Madam, I have a question,
Yes,
and
ma'am.
I just wanted to clarify. I think this is the you have discussed basic research, applied research, and another research is it's called as action research.
Yes, ma'am.
Basic research, what I feel, basic research is also called as a pure research. It's also called
And
as a
fundamental
fundamental
research.
research,
Yes, ma'am.
and it is done in highly expertise scientist or the investigator. Whereas, on the other hand, action research is done day to day problem to solve, and applied also applied research. For example, it is done day to day are smaller things. For example, at present in the hospital, something is going to happen. How to solve that problem? That is done as applied research. But here also we need little expertise person. But whereas in case of basic research, we need a scientist, other thorough investigator who has got qualified, and who we need a laboratory, we need the all facilities which is required for us. What I felt it, madam. Am I correct?
Yes,
There is
ma'am,
a
you are correct. But the
yes.
thing is, whatever research as students, everyone is doing, we put it in a basic research because it will
Uh,
never come up to the category of applied and action because it's mainly with the settings in the hospital industries wherever we are going to do research. They are the action research as well as the applied
no,
research.
madam. Basic research, three differentiation. Basic research is also called as fundamental. And when the
Yes, ma'am.
student does, that we call as, it is a partial fulfillment of their degree.
Yes.
That is a partial fulfillment of the degree. They do the research is called as just a partial. And whereas the
Yes.
basic, if you go for the basic, it's also called as pure research. It's also called as the fundamental research to discover certain things. That is what I felt it, and we can
No
discuss
issues.
it later. Yes.
Thank you.
Okay. Any queries? Any? Okay, madam. Thank you very much. Once
Thank you
again.
so much once again. Thank you so
Thank
much
you.
for the
Thank you.
opportunity we are giving to us. Thank
Thank you,
you.
madam. Thank you, madam. Thank you.
And thank you participants for active listening. Thank you.
Dear participants, our second plenary session will start within 5 minutes.